Hey everybody, so welcome to effective herbal management for gut flora dysbiosis in the horse and the dog. So there is a reason why we put the horse and the dog together, and that will all be revealed to you in a little while. But really this is about the herbalist's take on how we manage gut flora dysbiosis in the horse and the dog. All of the information we have here has come over from human studies, and it's how we look at the human body that we have just moved it over to use the same methodology to work with animals as well. Now, let me see if I can get that going. There we go. So this is everything we're going to cover. Effective herbal management for gut flora dysbiosis. We're going to discuss the traditional and effective herbal approach to regulating and restoring gut dysbiosis in the horse and dog. We'll take a look at how animals succumb to this condition and why they succumb to it, essentially. We investigate the systems involved, as well as highlighting how stress, sugar and diet contribute, because they are the biggest contributing factors to gut dysbiosis of the various different forms that there are. So we're going to have a little look at the available herbal support and how we can bring back to balance this dysregulated gut. So you'll get a herbal protocol for bringing back into balance dysregulation. It's very, very dependent on the animal in front of you. Again, there is no one size fits all when it comes to herbal management of gut flora dysbiosis, because each animal is such an individual. So what we're going to do is we're just going to look at the broader spectrum of herbs that can be used and the specifics of some of the herbs that you can use. And we want to do that because each animal is different. A dog is different from a horse. They're going to select preferentially one herb over another, depending on what's going on, because gut dysbiosis, although it covers the gut, it also covers many different areas as well. So what is it? So gut flora dysbiosis is an imbalance in the normal gastrointestinal flora. It is usually, but not always, associated with the small intestines. And this is really important because you can get gut dysbiosis that affects different areas of the intestinal tract. It doesn't always happen in the small intestines, which is why we can never do a one-size-fits-all approach using a very prescriptive herbal medicine approach. We can only give you ideas on the medicines that we use, and if we're using self-selection, we want our animals to select the most appropriate of this bunch and group of herbs. So essentially it's a problem regarding the ratio of bacteria present within the gut, anywhere within the gut. It's a problem of having one specific bacteria which has a higher proportion in the gut over others. Not necessarily a good thing. We want to have a balance of gut flora, but that balance of gut flora is very dependent on the individual animal as well. And when I say a balance, I don't mean that it has to be religiously balanced in terms of weight or number. I mean it has to be balanced in terms of specific ratios. So the microbiota in the gut consists of bacteria, fungi, protozoa, archaea and viruses. So it's not just bacteria that we're dealing with either. And disturbances within this microbiota, so disturbances of any of that bacteria, fungi, protozoa or archaea or viruses, will affect the fermentation process in the horse and the dog. Now this leads to lots of problems with assimilating vital nutrition. It leads to lots of problems then associated with either constipation or diarrhea, and that in turn can lead to kind of malabsorption, that can lead to leaky gut, that can lead to a lot of problems associated with the circulatory system and the cerebral system as well. So we need to have a whole animal approach to it. Now we know that there are fundamental differences between a horse's microbiota, evolved to aid digestion of forage, and a canine's microbiota, which has evolved to aid the digestion of meat. We know that there are differences going on there. However, the dysbiosis of any microflora is the same problem. It's still an overgrowth, or it's a disproportionate balance, which leads to the same outcome or similar outcomes for the animal. So we can have a unbalanced proportion in the dog, which will lead to constipation and diarrhea. We can also have an imbalance in the proportions in the horse, which will also lead to constipation and diarrhea. So we have the same symptomatic outcome regardless of whether we're dealing with the horse or the dog. So the research into the specifics of each species that make up the microbiota is a growing area. You've all heard of Carol Hughes and the great work that she's doing, and it's a real research area that's massively growing and has massively grown over the last 10 years, but it lacks a lot of key information. No one knows for sure the exact ratios that we're supposed to be dealing with. No one knows for sure the ratios of each of those microbiota, so each of those bacterial elements, each of those viral elements, each of the archaea and the protozoa. No one knows for sure the exact ratios that are supposed to be in the gut. No one knows the exact quantities that make up a healthy gut. It's very, very tricky research area. Now, only a handful of bacteria are actually being researched at the moment, and this heavily relies on those that are the most commonly found within the gut. So science believes that because they are the most commonly found, they are therefore the most important. And I'm not sure whether I can go with that 100%. From a herbalist perspective, I'm not sure that that is the right way to go, or the right theory and belief pattern, because I'm almost certain that a lot of these smaller quantities of gut flora, whether they're viruses or whether they're bacteria, are doing some really fundamental jobs within the gut. That's what they do. For example, of the top 5 bacteria found in the dog's gut, and these are called firmicutes, it's one of the largest group of phylum across the board. But there are over 200 different genera, and there are thousands and thousands of species of this particular strain. So you can see why research scientists have to cherry pick those that they're going to study, because the quantity within the gut is just so vast. So I think it's really important that we get across just how big the microbiota is within the gut and the kind of numbers that we're dealing with. So it's great that this research is going on. It's fantastic that they are studying these individual strains down at a very deep level, but we want to kind of open it up. We want to broaden it up to enable you guys to see what's actually going on. And if we're talking about thousands of strains of one species, and there are hundreds of different species and hundreds of different genera and loads of different phylum, we're talking masses and masses of numbers of individual strains of these microbiota. So we need to take that into account. So in addition, each part of the gut will house different bacteria. So the mouth will be different to the colon completely. Bacteria in the stomach completely different to that that's in the mouth and the colon. So for example, your eyes also have a microbiota of their own. The lungs have a microbiota of their own. Even your hands have their own microbiome. So once we start playing with this microbiome and we start picking and cherry picking those bacteria that we think are most beneficial, we're going to end up with some kind of dysbiosis. And that dysbiosis that we're talking about today is specific to the gut, but you can get dysbiosis in many different areas of the body. So how do we know which area to target? How do we know? Our animals are not like humans. They cannot talk to us. They cannot say, I've got a pain in my right upper gastric area. We can surmise some certain things. We can view using veterinary techniques. A lot of listening is going on about areas of the gut that are particularly active, and we can also do a lot of cultural analysis stuff, but essentially a lot of this is guesswork. So we don't specifically know which area of the gut to target unless we go for cultural analysis or fecal matter analysis of one sort or another. But these cultures only replicate what the gut flora is doing at a specific moment in time. So they are not a good guide to diagnosis. They are a snapshot of what's going on at a specific moment in time, but they do not reveal the long-term chronic disorders that are going on, because this can change over time. It changes over season. It changes in relation to food. There are so many other variables that come into play that we cannot use that as a diagnostic tool. So we just need to use it almost like a guessing game. So they reveal a problem with only a handful of microbiota as well, a handful of bacteria that have become dysregulated, and great work being done in the hindgut as well. It's good science. It's really good science. The science is there. The science is really good, but we're not quite there yet. I'm really looking forward to more research coming out and seeing where we end up in another 10 years, seeing how many strains they can actually get out and get us looking at. That'd be great. So why does gut flora and dysbiosis occur? So diet is the primary factor related to gut flora dysbiosis. In animals, it is largely related to the sugar and kibble related diet because they feed bad bacteria. They preferentially work on feeding the bad bacteria because they have large amounts of sugar in them and they have large amounts of carbohydrates. Sorry, let me just turn this off. Let me put it on airplane mode. So they prefer sugars. That's essentially it. So we want to try and modulate that a little bit. But gut flora dysbiosis can also occur because of medications. So medications are sterile in their nature. So they kill off a lot of the microbiota that's going on in the gut. The same can be said of non-steroidal anti-inflammatory drugs. Antibiotics, we all know about antibiotics. That's their main aim, is to kill everything going on and make the guts a really sterile environment so no bacteria can get in. That's their job. Steroids also do this by an interplay with the immune system, so they can deplete any microbiota going on. You will also find it with things like ulcer medications. Ulcer medications are specific to going into the gut and lining the gut and healing those ulcers, and they do that by sterilizing them as well and adding a healing element to them. So diet and medications, some of the biggest contributing factors to gut flora dysbiosis. Another one is stress and anxiety. Stress and anxiety disrupt the hypothalamus, pituitary and adrenal axis, and that has a knock-on effect essentially for insulin uptake. So cortisol inhibits insulin uptake. So when you've got too much cortisol going out, it's stopping insulin from being pulled into the muscles. And then you have another dysregulation that is largely the same as sugar as well. We have more sugar in the blood, and this can lead to dysbiosis. It's also a physical musculoskeletal problem because the gut essentially and stress there's an interplay between contraction and release, contraction and release. When you're stressed, you contract everything up. When you're not stressed, you release. So this contraction of the gut has a physical effect on gut flora as well. We also need to look at things like the immune system. Immune system and immune-mediated disorders, including self-immune problems, can occur. Things like colitis, things like Crohn's disease, and things like irritable bowel disease. They all come under this large umbrella of immune-related disorders. And you will normally find that if an animal has an immune-mediated disorder, it will have gut flora dysbiosis. There's a massive correlation between the two. And I've seen it consistently with all the animals that I see that have a self-immune mediated disorder. Nearly all of them will have a gut flora dysbiosis of some description. There is a huge link between allergies and asthma as well and gut flora dysbiosis, largely related to stress and the medication pathway too. A lot of animals who have allergies and asthma start off being medicated, and then that unfortunately leads to more and more of a sterile environment for the flora to populate. It's one of those things. So trauma and undernourishment. So if you've got a rescue dog, if you've found a dog that has been abused at some point in its life, you will find that there is likely to be a gut flora dysbiosis thing going on. There's likely to be an imbalance of gut flora dysbiosis. Now, all of these things affect gut integrity. So the integrity and the lining of the gut wall becomes weakened, and the tonicity, so the tone of the gut wall becomes weakened, and it can become a little bit flaccid, and we don't want that to happen. We definitely don't want that to happen. But there are other things as well that lead to gut flora dysbiosis too, that don't necessarily affect the integrity of the gut, but some of them do. So vaccines are a big one. They do affect gut flora dysbiosis because they affect the animal's ability not only to detoxify, but also its immune system too. So that somewhere along the line, there is normally a compromise in the immune system that to enable the vaccine to work, and that can lead to gut flora dysbiosis. Toxins and preservatives that you get from the environment also cause gut flora dysbiosis. Toxins, by and large, because of their ability to be eliminated out of the body, they are essentially a build-up of poisonous material or debris or inflammation. Same with preservatives, and these can have a knock-on effect on the immune system. They can have a knock-on effect on the gut as well. So lots of toxins and preservatives can cause gut flora dysbiosis. Parasites. If your animal has an overburden of worms or parasites, this can cause gut flora dysbiosis. We've all heard about redworm being encysted in the gut wall of many animals. That in itself will affect the structure and integrity of the gut wall, and that can lead to dysbiosis. Processed foods also go in there as well. So I'm not specifically talking about kibble here, but a lot of processed foods come with preservatives. They come with a toxin overburden. And this can have an effect on gut flora dysbiosis. But these are the main areas that you see. So it's always really valuable to investigate when you're going through a case history with an animal. What kind of things are happening here? So always ask and always dig really deeply about the kind of diet that the animal is on, not just now, but pre you owning it as well, or pre you going to see it. So find out its entire history, of its diet, because even some people who have swapped their animal from a kibble diet to a raw food diet will find that historically the gut flora dysbiosis is going to traverse that length of time. So you may have a problem that initiated when the puppy or the animal was 6 months old. It's then gone on to have a fantastic lifestyle, fantastic diet, but there is something in the gut that has not been enabled to restore itself or go back to balance. So always look a lot more historically at diet. The same with medications. You might have an animal that suffered a trauma as a puppy, and you'll ask the owner, are they on any medications? And they'll say no. So investigate the history of an animal's medical history. So always look for what medications has it been on, not just now, but historically as well. Same goes for stress and anxiety. Always look at the historical context. Immune disorders you're likely to see consistently. If they have an immune disorder as a young dog and they've not been enabled a holistic approach to get out of that immune disorder, you're likely to find that it's still present. But it will give you a good idea of how long the gut dysbiosis has been going on. So if an animal was fine up until it's 2 years old, all of a sudden it developed an immune-mediated problem, the animal is now 10 years old, you know that it's going to have had gut flora dysbiosis for a minimum of 10 years, quite potentially pre the immune-mediated problem occurring. So look historically. Same with allergies and asthma. There's a huge correlation between animals being born and the birthing process and allergies and asthma. Now, animals being born it's the first port of call where animals reach the outside world, and it's their first interaction with bacteria, viruses, protozoa, everything to do with the microbiota. It's where they build up their microbiota. If for whatever reason they have not had a normal start in life, so for example, if they were born by a cesarean, they will have not gone down the birth canal, and they will have not got their lungs filled up and their digestive system filled up with a lot of the microbiota coming from the mother. So it's going to be very depleted from a very young age, and then they go on to develop allergies and asthma. So always ask about the birthing process if you know. If they know, they may not know. You know, was it a straightforward birth? Were they born by cesarean section? How did this animal come into being, and what was its first experience of the world around it? Did it get that opportunity to go down the birth canal and take all of the mother's microbiota? We hope so. Again, with trauma and undernourishment, I'm hoping you will all know that the animal in front of you has suffered from trauma and undernourishment at some point in its history, but just be mindful that that some people might not know, particularly when it comes with horses. You know, they do get passed on from yard to yard to yard. They may not know the full history, and I do understand that, but dig around as much as you can. Try to get as much valuable information as you can. With regards to vaccines, we kind of always ask the question, are your animals vaccinated? It's just one of those things you're just going to have to put on the tick box. It's going to be a yay or nay, and it's very dependent on the individual owner that you're dealing with, whether they vaccinate or whether they don't vaccinate their dogs. But support the liver if they do. Toxins and preservatives, you're not always going to know. It's never going to be 100% reliable what this animal has been exposed to. But this is another good reason why working with the liver is so important, because we just don't know. We just don't know. So we'll take it for granted that they may have been exposed at some point to toxins and preservatives, and we want to investigate as well the owner's home. What chemicals are they using around the house? What antibacterial spray are they using? Do they use the antibacterial wipes that you can see? Particularly since COVID as well, lots of people are out there with alcohol sprays and alcohol gels, and our animals are being exposed to this on a daily basis. So do investigate that as well. Parasites are going to be another one that you may or may not know whether the animal has been exposed to. A lot of people will be deworming their animals on a regular basis, and a lot of them are going to be doing teeter testing, or they're going to be doing fecal egg counts. Just have to weigh up about where you're going and have a look at the full history, and potentially the animal might have been exposed to parasites at some point. And again, the same with processed foods. Dig about as much as you can, not just in terms of the diet in relation to kibble or grain if you're dealing with horses, but in terms of what other processed foods have these animals been exposed to in their past. And it will reveal a lot. It will reveal a great deal about what's going on. So, symptoms associated with gut flora dysbiosis. So they are different depending on the dysbiosis that is essentially going on within the animal. But there are many signs and symptoms which are related across species. Okay, so one of them is stiffness in the joints. And this is because the microbiota is not able to assimilate a lot of nutrition, and a lot of toxin buildup happens in the joints as well. So there is another correlation and a few other pathways that lead to this, but you're looking for stiffness in the joints as well. Many animals might be suffering from a shortness of breath. They're finding it very hard to get oxygen around the body. This could also be related to the asthma and the allergies side of things, so because there is a big connection there. So shortness of breath is another one. Explosive energy is a good one, where they are able to assimilate to a certain point, and then they have an episode of bad bacteria overtaking, and they get explosive behaviour and explosive energy. It could also be related to pain, this explosive energy. I'm not sure on the connections here, but never rule out that there might be a pain element involved in that as well. Weight gain or weight loss is a big one. You might get an animal that gets really incredibly bloated because of the disruption in bacteria. You could also get an animal that loses weight exceptionally quickly. So look out for weight gain and weight loss. Always ask your owners whether they are experiencing this and whether they've seen that in their own animal. Animals with gut flora dysbiosis do suffer from poor exercise tolerance. You can have an extremely fit animal and its tolerance is very, very low. It could be very high one day and then very, very low the next day. So do look at that. Again, that's a problem with assimilation, and it's a problem with oxygenation of the whole body. One of the biggest things that you're going to see or that your owner is going to be aware of is constipation and diarrhea. Now, some animals will have diarrhea consistently. Other animals will be consistently constipated. When you have an animal that's got something like colitis, you will find that it differentiates between the two. So you might have diarrhea one day and then constipation the next. So it could also be a swap between the two. So do keep an eye out for that. And it's always a good question to ask. Do they suffer from constipation and diarrhea almost at the same time? Does it change daily? Now, you will get irritable bowel, colic and bloat. So we know that colic and bloat are veterinary emergencies. We want to see the vet in the first instance for those. But if your animal is consistently coming down with bouts of bloat and bouts of colic, it could be an indicator. that your animal has a gut flora dysbiosis going on. So we want to keep aware of that history, and we really don't want to get into a colic situation. But if the owner is saying, you know, it's another bout of colic that I've had, this is the third time in, you know, the year when this has happened, we need to start thinking that the microbiota is somewhere imbalanced. You also get behavior swings. So this is a bit like the explosive energy, but animals can go from very, very low and depressed and just not feeling themselves, a bit sluggish, to being very joyous and very happy and unable to contain the excitement. So you do get these mood swings that happen quite a lot. In dogs, you will get things like bad breath. Bad breath is a big indicator that your animal has small intestinal bacterial overgrowth. You can get tests for SIBO, S-I-B-O, but you can normally tell just by the state of their breath. It stinks. It's not nice and it's not pleasant. You need to start differentiating and have a good look in the mouth to make sure that there's not something that's going on in the mouth. But if you can tie it in with some of these other symptoms that you see, you're beginning to build a picture about what's going on. Again, I've got joint stiffness down there, but your animal is also open to much more infection going on. So it could scrape itself, it could get an external injury that isn't really significant, but it takes a long time to heal. You'll notice this in horses too. They will get quite a few scrapes and scratches, and you'll be speaking to the owner and they'll say, do you know what, this has taken weeks and weeks to heal. It was really small. I don't know why it's taken such a long time to heal. It could be potentially because they have an immune mediated problem that is leading to gut flora dysbiosis. So it's worthwhile investigating that area as well. So have a look at all of the signs and all of the symptoms and investigate these with your owners. You know, really go into quite a lot of detail about them. So herbal management for gut flora dysbiosis. So what I've done is I've broken it down into 6 steps because I think that's probably the easiest way to remember it. So what we're going to do, herbal medicine has traditionally been excellent. It has an excellent track record in treating gut dysbiosis. Why this is, nobody really knows, but we can assume that it's because herbal medicine doesn't distinguish between the different strains of microbiota. So we do differentiate between bacteria, fungal, viral, or protozoa. So we do differentiate between those. But what we don't do is take the specific strains of each of those and try to modulate each of those strains. My theory is that it just doesn't work. You need to be looking much more holistically, and you need to be looking at a much bigger picture. But that's my herbal medicine take, and this is the herbal medicine take that most herbalists will look at. So we want to look at the whole animal, and we want to address the root cause first. So we want to address the root cause of why gut flora dysbiosis is going on. Secondly, we want to restore gut integrity. This is the most important thing. You can go and modulate gut flora bacteria all day long, but what you cannot do is restore the gut's integrity, because then gut flora dysbiosis is just going to come back. It's just going to keep coming back until you've restored and nourished and supported the gut in itself. What we want to do is support the associated systems. So all of the systems that are associated with gut flora dysbiosis. So that could be the immune system. It's most definitely the gut. It's also the liver, but it could also be the cardiovascular system and the lymphatic system. So we'll go through some of those as well. Now, this is the big one. This is what herbal management actually is, and it's a very simple 3 steps. What we want to do is weed it all out, take the whole lot out. We want to get rid of as much bacteria as we can possibly do. We want to get rid of as much fungal stuff going on and as much viral stuff going on as we can. Then we want to seed, completely reseed, and then we want to feed those seeds. So it's a really easy 3-step plan. So we weed it, we seed it, and then we feed it. And this is why herbal medicine works, because we're not looking at those individual strains. We're not going down into too much detail. All we need to know is that we can weed it and seed it and feed it. But we want to address the cause first. So if it's a diet related problem, look towards the diet and see if you can start addressing that diet. First instance, very straightforward. It's going to take a long time to address gut flora dysbiosis, depending on how long it's been going on. Normally, gut flora dysbiosis is a chronic long-term problem. Very rarely do we see incidences where it changes very quickly and it can be brought back to balance very quickly. So the quicker, the more acute the problem, the quicker we can fix it. The more chronic the problem, the longer amount of time it's going to take to fix it. It's the same when you work musculoskeletally, and it's the same when you work with the gut or the liver or any aspect of health and holistic care. The longer it's been going on, the longer it's going to take to fix. So work with the diet, and this might take many months for you to very gradually change over this particular animal's diet, but it will be a lot of investigative work about the specifics of the diet. You want to have a look at medications. Now, we're not going to be able to change a lot of the medications that animals are on. It's the preserve of vets to be able to do this. So if you do feel that there is an element of medications that are causing the gut flora dysbiosis, the best thing you can do is support the liver to eliminate those medications as quickly as possible. So we're not going to be able to take the animal off medications, but you can definitely have a chat with the vet about it, definitely talk to them, definitely discuss this whole concept with them about gut flora dysbiosis and why you think the medications are causing a problem. Many vets will be open to changing a medication, and they may also be open to you doing investigative work in conjunction with them. But primarily, support the liver. Once you're supporting the liver, you're aiding the elimination of those medications as much as possible. We want to address stress and anxiety, of course. I think that goes across the board without saying. We don't want any animal that is stressed, and we don't want any animal that is suffering from anxiety. So if that is a primary cause of the gut flora dysbiosis, really work with nervines and really work with restorative central nervous system herbs. If the animal has an immune system disorder, like colitis, like Crohn's, or like IBD, we're not necessarily going to be able to address the cause of that. So what we have to do is work to support the gut so that it can heal itself. Allergies and asthma is another one. We can kind of get to the bottom of allergies and asthma, but that is through working with the liver and working with the gut. Trauma and undernourishment can easily be addressed. Trauma might take a little bit longer. Undernourishment, definitely. I've seen quite a few animals who have started off as rescue animals and who have, their start in life has been undernourished. They've been very wormy. They've suffered from bloat and loads of gas. And they can very quickly change it around from undernourishment to nourishment. Sometimes that leaves a big problem with the gut, and it's not able to assimilate nutrition as effectively as it would. Again, another reason why we support the gut to heal itself. You want to cut out all processed foods across the board. Just get rid of them if you can. You also want to potentially address the problem with vaccines. Again, this goes hand in hand with medications. We want to enable the animal to eliminate as much as possible. Same with preservatives, and the same with parasites. So we want to address those causes and support the liver as much as we can. Biggest thing we can do after we've addressed the cause, or after we've addressed the element that we think is the cause, because we're never going to know for sure. It's always really good to have a good discussion with your vet to find out what the cause is. But to restore gut integrity, make this your number 2 on the list. Do this across the board for all animals. So what we want to do is we want to soothe that gut. That gut will have been in contraction because there's a dysbiosis of gut flora going on. So it's going to be in contraction. So you need to soothe it and protect it. You need to have a bit of mild astringency because the gut wall or the lining of the mucosa becomes compromised. It becomes very, very weak. And it allows products and debris and inflammation to cause more damage and to start leaking across the barrier. So that's what leads to leaky gut syndrome, essentially. A little bit of mild astringency will help to tighten those junctions within the gut. You don't have to go in with really strong astringents because because the gut is weak and because it's compromised, if you go in there with some strong astringing herbs, you're going to tighten it too much, and that just leads to more contraction. So we don't want to contract it. We don't want it to be under any undue pressure, but we do want a little bit of mild astringency just to start pulling those junctions a little bit tighter. We also want vulnerary and styptic herbs. These are really important if your animal has colitis or Crohn's, because there will be ulceration within the gastrointestinal tract somewhere along the line. So we want vulnerary herbs that are going to soothe, that are going to start healing, and that are going to start mopping up the blood a little bit, because you might get tears and things like that. You might get internal bleeding that's happening. We definitely want antispasmodic herbs. We want herbs that are going to stop the contraction, and we want herbs that are going to slow down the transit of nutrition. I know it sounds contradictory. What we want is nutrition in our animals, but when the gut's working so hard, it can go into spasm, and then it just starts kind of going into hyperdrive. We really want to slow that down, and we want it to rest, and we want it to repair. So antispasmodics across the board. The other one that you're going to need across the board, this is almost a given, is mucilaginous and demulcent herbs. These not only help to slow down the transit of nutrition and medication, so we need to be wary of the medicines that are on, but they also help to line the gastrointestinal tract from mouth right through to anus. So regardless of where the gut flora dysbiosis is, they are really helping to soothe and line and nourish gut integrity. So we want to start using mucilaginous herbs. I've put a list here of my favourite ones. I mean, chamomile, as far as I'm concerned, should be in every single gut remedy. It's beautiful, for want of a better word. It does no harm, and it's very, very gentle in its nature. It is an antispasmodic. It's a vulnerary as well. It does have a mild astringency to it, and it's really soothing. It doesn't have a lot of mucilaginous quality to it, but it is a very wet herb. It just feels wet. It's got neutral energy to it as well. So chamomile can go in any offering, as far as I'm concerned. Just make sure that you get chamomile into that animal. If you need to feed it as a tea, or you need to make it as a tea, or if you need to offer it as a fresh herb or a dried herb, or even a dried powder, give it a go, because we know that an animal might not select the one product that we have, but if we can get chamomile into them, we are really a strong way there in fixing the battle. Chamomile also has a mild antibacterial element to it, and it's specific against Staphylococcus bacteria. So it has an antibacterial element to it and an antimicrobial element to it, which is really going to help when we get further down the line. Plantain is another one, a deeply healing and nourishing support for the gut. Again, it's another herb that I wouldn't be without when I'm looking at restoring gut integrity. It's mucilaginous, it's antispasmodic, it's a vulnerary, it has some mild astringency, and it's soothing. It's also a specific for asthma and allergies. So another one that could be really beneficial depending on the etiology and the root cause of the problem that's going on. Calendula is another one. It's soothing. It has antimicrobial properties and antibacterial properties as well. It is a mild astringent as well. So again, it's going to help to tighten up those tissues within the gastrointestinal tract. It's antispasmodic, and it almost goes with chamomile. If ever I'm offering chamomile, I always add calendula in there too. It's really good at helping to mop up debris and helping to get rid of debris that's travelling around the lymphatic system. So it works just by getting rid of a bit of rubbish that's going in the body, and it just delivers it to the liver for processing. So another really valuable herb. Iceland moss is quite specific. I would only really use Iceland moss if I've got an animal that's got IBD or Crohn's or ulcers or a gut, or I don't want to say a gut flora dysbiosis, but that's got a symptom that is leading to the gut flora dysbiosis. So like ulcers, although ulcers are not gut flora dysbiosis, they would lead to gut flora dysbiosis. But because ulcers and anything that's tearing or bleeding within the gut is a heating problem. Iceland moss is really good at just cooling everything down. It's really mucilaginous and really demulcent, and it's a strong antispasmodic as well. So it just helps to cool the fires that are burning in the gut. So really beneficial for that kind of thing. Slippery elm, I'm not a big fan of. I'm not a big fan of because it's endangered. However, I do use it and offer it occasionally in conditions where it's specifically indicated. And restoring gut integrity is one of those things. So it can be really, really beneficial because it's soothing, it's antispasmodic, it's got a vulnerary action to it as well. And it does have some astringency too. So really beneficial for the gut. Raspberry leaf is one that you're going to have to decide whether the animal wants it or not. It's very astringent and quite drying, so it might be too much for some animals. However, it does have an effect on the entire gastrointestinal tract. So if you've got a spasm that's going on within the gastrointestinal tract, it's a really nice, nourishing and supportive herb that will just help to reduce that spasm and to dry all the tissue up a little bit. So it could be really good if you've got a mare that's scouring, suffering from dysbiosis, and it's got this interplay between constipation and diarrhea. So offer it in the first instance. Licorice is a nice soothing one for the gut. Really good for anything to do with the lungs, but specific for helping to aid the gut and to reduce stress and anxiety. So although it doesn't have like an astringency quality, it can be quite soothing. What it really does is help to mediate stress. Now, if your animal has got gut flora dysbiosis for whatever cause, it's going to have a stress element involved because it's not very well, because the gut is out of balance. So there will be an element of stress that needs to be modulated. And licorice root is fantastic at doing that. So it just helps to calm the entire system down. And it's very adaptogenic in its quality to do that. Now, I've also put mallow root here because this is the one that I would prefer you use over slippery elm. There is quite a bit of research that says that actually they have very, very similar properties, and our native mallow root and Althea officinalis can be used almost to replace slippery elm because it is an endangered species. I've also found that working with animals, mallow root is much more easily selected and much more readily selected by animals than slippery elm. Maybe that's because it's a native, who knows. And another thing that you need to think about is L-glutamine. Now, L-glutamine can be bought as a supplement, over-the-counter supplement, but it has some really great research in modulating gut flora. It works on a specific pathway in the gut to do with elimination and detoxification. So do look into L-glutamine because it can be really beneficial if your animal has gut flora dysbiosis. Definitely one that's worth looking into. So then we start off with weeding. So how do we weed gut flora? Like, what do we do? This is often the most, I don't want to say the most obvious element, but it's often the area that is overlooked. How do we get rid of gut flora in the gut? What do we do? It's quite a simple process. We literally just kill it all. We want antimicrobial and antibacterial herbs or antifungal herbs to go through the gastrointestinal tract and really reduce the proportions of all the gut flora, of all the fungal stuff that's going on, of all the protozoa. We want to just reduce everything. So we start off on an even keel. Things that can be, herbs that are specifically indicated for this are herbs that contain berberine. So berberine is a strong antibacterial herb or constituent, and it's a strong antimicrobial herb. Quite a few herbs have this in them. You have things like berberis, mahonia, hydrastis. It's also strongly astringent, and it has an antifungal element to it as well. So regardless if it's bacterial or fungal, you can still have berberine in and it will still have an effect. You also have strong herbs like Artemisia absinthe, which are strongly antimicrobial. Any herb that has a strong aromatic quality and an oily quality to it, so all essential oils and all volatile oils have an antimicrobial action across the board. Some are stronger than others, but if you get an oily herb, it means that it has an antibacterial and an antimicrobial property to it. So the breadthness and the vastness of herbs that you can choose from is quite great. The problem with using antimicrobial herbs is you need to get them inside the body. You need the animal to ingest them. That's where it can be a bit tricky, because animals, essentially what they do is they smell the volatile oils in these herbs and they kind of go, I'm not sure about ingestion. So you have to use your knowledge, and you have to use as broad a breadth of antimicrobial herbs as you possibly can. There are some good natural forage ones, like I said, Artemisia, absinthe, mugwort is another one, rosemary is a really good one. Thyme is also particularly good. I have seen dogs eating thyme straight off of the bush, so it can be done. Oregano is a big one. You will come across people feeding oregano oil to their animals, putting a couple of drops in their food. Not my preference. I don't have a preference for oregano, I have to say, over anything with berberine in it. I prefer to use herbs that have got berberine in it. But you can also use things like holy basil. Holy basil has a strong antimicrobial element in it. So any of these herbs that are strongly aromatic, have a berberine quality to them or an oily quality to them, will effectively weed out bad bacteria. And what we're doing, like I say, is we're not playing with the individual strains of bacteria or the individual strains of fungus that are going on in the gut. We're just reducing the whole lot. And because we've already supported the gut and we've nourished the gut and we've restored gut integrity, the gut will then be able to start using receptors and neurotransmitters much more effectively, and it will be able to balance its own gut flora much more effectively. But we can give it a hand too. So what we do next is we reseed everything. We repopulate the gut. So we've essentially reduced all of the gut flora. We haven't taken individual strains because we don't need to. We must trust that the animal can do this on its own, and that the evolutionary microbiome is fit for purpose, that it is able to understand and know what's going on in the gut of its own body. We really must give it some credit for doing this, because the research is not there on the individual strains. So how can we repopulate when we don't know what the real balance is supposed to be? So what we do is we use more herbs to repopulate the gut. We allow the animal to repopulate its own microbiota. We can do this by enabling them to eat as many different soils as we possibly can, loads of different clays, and allow animals to eat other animals' fecal matter. I have heard of vets who will take a particularly healthy dog, and you can do fecal transplants, but I've also heard of vets allowing these dogs just access to really, really healthy poo, essentially, so that they can eat it. There is a question mark over whether you use over-the-counter pre and probiotics or probiotics. I prefer to let the gut get on with it. I just want the gut to have as much access to the natural flora and fauna that is around them, so that they can modulate and repopulate the gut itself. It's a very tricky one to do, but that's the best way to do it. It really is the best way to do it. Allow them to eat the soil where you live, allow them to eat clay, allow them to eat other animals' fecal matter. And it's a very simple process, because once you've weeded that gut, the receptors in the gut are going to say, actually, I need to repopulate gut bacteria, and the best way that I can do this is through the soil and through the clay. So they will do this. I also do have some, I don't want to say ability, but I do have some, I don't know what the word is, but you can offer things like kefir, and you can offer things like kombucha separately. It's always a good way to get gut bacteria in. Give it a try, but definitely allow them to eat soils, clay, and fecal matter. The problem with feeding or enabling access to things like kombucha and things like kefir is that they're very specific in the strains that they use. So again, the potential is always going to be there that you might be repopulating the gut with a strain that is already or that it's been trying desperately to reduce over a period of time, which we don't want to do. So I always do think that it's best to let the animal decide how it repopulates its gut, and you can do that by allowing them as much access to the forage as you possibly can. There are no specific herbs, I'm afraid, that are good for repopulating gut bacteria. There are herbs that feed good bacteria, but there are none that specifically repopulate it. So let's use soils and clays and let our animal have access to the delicate microbiota that's in the soil. So then we move on to feeding that gut bacteria. So what we've done so far is we've reduced all of the bacteria in the gut. We've then given the animal an opportunity to repopulate the gut, to find its own balance and its own microbiota by allowing it into the soil and by allowing it to eat poo and by allowing it to eat clay, where lots of valuable microbiota live. After that, you want to give them the opportunity to feed that good bacteria, or to feed that bacteria that's in the gut. Now, self-selection obviously is the best way to do this, because we want them, and we want those gut receptors to make up their own mind about what is beneficial and what is not beneficial in the gut. But here are some that you can offer. So chicory is a renowned prebiotic. It's what they make over-the-counter prebiotics with as well. Garlic is another one. If you want your animal to eat garlic, it does have an antimicrobial element to it as well. So it could also be feeding good bacteria at the same time as reducing bad bacteria. So garlic's always a nice one to offer. Anything that's got a root will have an inulin quality to it, and that inulin quality is what feeds bacteria. So we want to offer things like burdock, elecampane, dandelion and asparagus. The list I've got here are some of the highest that you will find in inulin. But inulin is only one product that feeds bacteria. There are many different elements that feed bacteria. Like I say, you could use kefir and you could use kombucha at this particular moment in time. It's almost worthy of a trial once you've gone through the process of weeding and reseeding. And at this point, you can then go, maybe we can help you out. Maybe we can help you to rebalance that gut. So inulin is actually an indigestible product, and it acts as that prebiotic. So it feeds bacteria, enabling the gut to repopulate. This is where we have to trust that the gut can repopulate and communicate with the rest of the body about what it needs. And it works very, very effectively in the human body. I trust that it works effectively in animals too. And I do find that if you can weed, seed and feed, the battle's done, but you must make sure that you support the integrity of the gut lining in the first instance. So yeah, use all of those nutrient-dense roots, essentially, because they all have an inulin quality to them. Now, you want to keep it simple. It's really important at this point. Just keep it simple. You don't want to overburden the animal with too many options of restoring gut flora, because hopefully we'll have done this by this point. Now, nobody can say how long it's going to take. It might take 6 months, it might take a year, it might take 2 months. Nobody can say for sure, and it's very much a process of trial and error. You just have to go in there to support the gut until the animal's behaviour has started to change and it's telling you it feels a bit better. Once it starts feeling a little bit better, then you go in there and you do the weed, seed and feed. And then after that, hopefully you'll be on a journey of complete recovery, because that's the thing. This herbal medicine approach is a long-term approach. Once you've restored the gut, once you've worked with weeding, seeding and feeding, the problem should be over and done with. You shouldn't have to revisit this problem time and time again. So what you do is you support the other systems as well. You must always support the liver. The best herb that we have is milk thistle. I use it so much to support the liver. It's restorative, it's nourishing, and by that very nature, it aids in detoxification of any of these other things that are going on. You want to look after the blood. You want to help the body to cleanse and clear not only errant bacteria that have got out and are leaking about, but you want to help clear the detoxification pathways, particularly if you're using glutamine. You want to be able to get rid of inflammation and debris in the gut, because it's a process of healing and repair. So that process of healing and repair is going to remove into the blood lots of products and lots of debris. So we want to support the blood to get rid of it, to take it to the liver for processing. So we can use herbs like echinacea and burdock, just two really good ones. There's no need to offer, 10 different blood cleansers. Just offer some really good, reliable ones. And burdock and echinacea are good, reliable blood cleansers. You want your animal to have the opportunity to select antioxidant herbs. You want them to ensure that oxygenation through the body is at its maximum and optimum level. So all of the process of repair and all of the process of metabolism will lead to oxygenation at some point. So we've got all these free radicals that are floating around the body. We want to get rid of all of those free radicals so that oxygen can then go into all of the vital organs, improving nutrition. So again, it's very similar to like looking after the blood. We want to get rid of all of the debris that's building up because of oxidative stress. So provide lots of oxidants to these animals. It's going to be a particularly beneficial protocol. You also want to support the lymphatic system. I support the lymphatic system with every herbal offering I do, and I usually do that with calendula. You can do that with cleavage. You can do that with devil's claw as well. But really keep it simple. Just give the animal the opportunity to restore its immunity through the lymphatic system. And again, it's another aid to getting rid of rubbish. So once we get rid of rubbish, nutrition and oxygen are going around the body much better, and they're going to all of these vital organs much quicker, and they're restoring all of these organs much better. So again, you've got gut integrity that is being permanently looked after. I would suggest that you keep on with this very simple protocol for months afterwards, for months and months after you've worked with weeding, seeding and feeding, just so that you give the animal ample opportunity to support all of the other systems that are going on. Yeah. Now, over-the-counter prebiotics, I mentioned this a little bit earlier. So we do not know the exact composition of bacteria in the gut of any animal. Like, it's not been mapped out in full at all. I think we're nearly there. It'd be so interesting to see the research, but we're not quite there yet. And there are just too many variables as well going on. So the formation of the biome, essentially, in the gut, specifically in the gut, is based on many factors. I mentioned birthing earlier. That's probably the earliest that any animal will have exposure to a microbiome, is coming down the birth canal. We also have to take into consideration things like breed. The location that your animal is kept on is going to be a massive contributing factor. And with the premise of like finding like, if your animal needs something, you'll be able to find it in the environment that it's living in at that moment in time. So your location massively affects microbiota, and it also helps to restore microbiota. So this is why we want them to eat soil at that repopulating stage. Feed that you're giving is going to be a massive factor. Genetics is going to be a massive factor. The season and temperature also affect the microbiome. It fluctuates depending on the season and depending on the temperature. So if you have a prolonged period where the temperature is really hot, the microbiome is going to change in relation to that season. It doesn't necessarily change within 24 hours, but if you have a prolonged period of heat, it will change. So hydration is also a thing. The water that you're using, are you using tap water? What kind of pipe work is this animal exposed to? Is there a microbiota in the water that could potentially be affecting the microbiome? Now, for horses, this is going to be really difficult because nobody wants to be lugging, huge quantities of fresh distilled water from one place to another. So for some people, you're just going to have to put up with that water quality. But aid elimination, support the gut, and then the bacteria won't be able to flourish anyway. But the list is much, much longer. It's a massively long list of the things that can affect the formation of the microbiome. So there is some research that suggests pre and probiotics might help in certain situations. I'm not anti, by the way, pre and probiotics at all. I just I just think that they should be measured in their use and very specific in their use. So the thing is, nobody knows the particular symptom that's displayed, or the particular disease that's displayed, and when probiotics should be used. Most of the research comes from anecdotal places. And so what they've done is they've gone out and provided a probiotic or a prebiotic, and it works. And they've gone, yes, it works in these situations. It works maybe 50% of the time in those situations. It doesn't necessarily work in every single situation. This is why I'm not anti pre and probiotics, but I do think they should be used in a measured and timely manner. I do think if you're going to use pre and probiotics, then you will need to get a fecal egg analysis done. You will need to get a microbiome test done to ensure that you're feeding the right kind of pre and probiotic. And I don't think you should go in there blind at all, because you can cause more problems than you're actually going to fix. And we have no way of knowing what's going on in the gut unless we get that fecal transplant. And then once we've got that, we're only dealing with individual strains. We're not dealing with the gut as a whole. So I do tend to stay clear of pre and probiotics, but I have also suggested to some owners that in this particular situation it might be really useful. So always consider allowing the gut to repopulate and restore itself naturally. That takes time. It takes time with herbs. It always does. It's the nature of herbal medicine. It's a timely process. It will be the most effective way forward for that specific animal. And that's because the more diverse the forage or food that you're providing and that's going in, the more diverse the populations of bacteria will be. So we're not dealing with individual strains. We're just saying, do you know what? We've restored the gut. We've killed we've not killed it all off completely, but we've reduced the levels of bacteria across the board. Now it's the gut's opportunity to take what it needs. Let's give the gut as much variety as we can in the forage and in the food so that they can grow. So yeah, I'm not anti pre and probiotics. I'm not 100% convinced yet. One of the other things that I really think is important is hydration. Once tissues are hydrated in the gut, they work much more effectively. A gut that is not hydrated, not only will it contract because of the lack of hydration, cellular repair is not going on as effectively as it could be. Detoxification is not going on as effectively as it might be. And oxygenation is not going on as effectively because all of the vessels and all of the veins become a little bit compromised. They become dry and a little bit stickier than they normally would. So blood travels around the body at a much slower rate than it normally would do. So ensure that your animal is fully hydrated. Not only will this help to flush out toxins that are in the joints and in the blood and in the tissues, but it will also help the gut. And if the gut is working much more effectively, it's going to be able to recognise the difference between good bacteria and bad bacteria. So it's going to be able to repopulate it itself. It's going to give it just another element to consider. So always flush out toxins, get your animal hydrated. Use whatever tips and tricks you can to get them to drink is really important. The other one that I wanted to discuss a little bit about was fecal transplantation. Now, some vets do offer this. I've seen it a number of times in the human field. I think I've only seen it once in an animal field. In all cases, it's worked. It really, really has worked. And it's been a lifesaver, I think, for a lot of people. Because of the expense involved in it and because of the process of having to go through and do it, it's often prohibitive in the animal field, which is why we just want them to eat poo. Just let them eat poo. Let them go out, particularly when they've had a gut flora dysbiosis and they need to repopulate. They're at that stage where they're repopulating the gut. This is the most effective way to let them do it, along with the clay and along with letting them eat soil. Get their body used to the microbiota that's around them and near them. Yeah, and you will also find that the dogs that are near you locally or the horses that are near you locally that are fit and healthy and don't have gut dysbiosis will pass on that healthy microbiota to the animal. So it's a good way of repopulating growth, letting them eat poo. You can look into fecal transplantation. Like I say, it's very cost prohibitive for most people. It's definitely not for everybody, but they do offer it as a service, and it is very effective. So what we need to do is we need to support the whole by looking at each case individually. We want to look at the root cause of what's going on in each case, and we want to start addressing that. We want to support the gut, but we also want to support the liver to aid all of that elimination. We want to support the lymphatic system so that immunity is less compromised. Remember that 70% of immunity is in the gut, and the rest of it is built in the lymphatic system. So we've restored the gut by using a lot of those herbs that I mentioned at the beginning. So that's really good. So the immune system within the gut should now be working at its optimum. If the lymphatic system is not working at its optimum, we're only going to have a 70% increase in immunity, or in the balance of immunity, the modulation of immunity. If we support the lymphatics, we're looking at 100%. We're looking at 100% of the immune system working at its optimum, which is what we want. We really want that. So always support the lymphatic system, whatever you're doing. We've talked about using an antioxidant-rich diet because we want all those free radicals to be released. We want to get rid of them because in the process of repair, in the process of restoring the gut, and the process of rebalancing gut flora, we're going to have a lot of free radicals running around just where they've all died. So we want to get rid of those as well. And antioxidant rich herbs will help do that. So anything that's got a berry, essentially, anything that's bright in colour and has got a berry is going to be really, really helpful. Again, I've put lymphatics down twice, no idea why. And also I wanted to just mention time. I've said it a couple of times already. The longer a problem has been going on, the longer it's going to take to fix. I would say that an animal that has had gut dysbiosis for a month and you've picked it up really quickly is probably going to take a month to fix. For an animal that has had gut dysbiosis going on in the background gradually, it's been working really well, it copes really well with its gut dysbiosis, but you know there's a problem and you want to start addressing it. You're probably looking at a year, 18 months before you can get the gut fully healed, fully restored, and that animal back to balance, where it's able to take over its own job of restoring gut flora. So yeah, but each animal is really individual. You might have a really healthy 10-year-old horse. You might have a really unhealthy 2-year-old horse. It's very dependent on the animal in front of you. But stick to this kind of protocol. Stick to the protocol of restoring the gut, addressing the cause, and then weed, seed, and feed. And that essentially should be everything that you need to support long-term change within the animal. So I've provided this PowerPoint for you. Here's the bits that's really important, this 6 steps here. So stick to that and you will be able to address the problems associated with gut dysbiosis, regardless of the cause. I have to say, regardless of, I don't want to say regardless of the cause, but regardless of the disease. So it could be that the animal's got colitis. It could be that they have just a standard gut flora dysbiosis. They just have an imbalance in gut flora. So they could have SIBO, small intestinal bacterial overgrowth. They could have Crohn's disease. If you stick to this protocol, you will see positive change, and you will be able to restore the gut to normal function. So take care all. I will provide you with this PowerPoint. It's yours to keep, and do what you want, store it as you will. So I'll speak to you all very soon. Take care all. Bye.